Welcome. I'm Fung, and you are watching Just Picture It. Tonight, we'll be looking at new ways to keep people healthy. What can we do within a community to look after ourselves and improve our health? It turns out the answer is a lot, but we need the information in order to make the decisions, understand what's going on, so that we can get us healthy. Now, the United States is full of people helping each other do better. So somewhere, someone has worked out some of the answers. Tonight, we're turning our focus on San Diego. Dr. James Killeen is professor of emergency medicine at the University of San Diego, and he's been working there to meet the needs of the community. Tonight's guests, Desmond and Kevin Montgomery, are here to show us what's been happening. Desmond is the president of the CIMI Group, a leading innovator in healthcare and public health solutions. His forte is connecting government, non-government, and private sector leaders with community stakeholders to solve problems. Kevin Montgomery is an innovator, academic, and researcher who has been doing work with the Army and the U.S. Department of Defense, amongst many other important players. He is the CEO of a startup company called IntelliSense Technologies. It spun out from Stanford University and NASA, and it provides massive data integration at a global scale. This means it's collecting millions of layers of data from sensors, online databases, social media like Twitter, Facebook, and thousands of blogs, as well as satellite and aerial imagery. Kevin is also the 2013 recipient of the Entrepreneur of the Year Award. Welcome, Dan and Kevin. So how did you guys get started working with San Diego?
Well, I think it's best to start with the doctor at the emergency department. Okay. And so here we have an image of a doctor, in this case, a famous doctor from the TV show ER. But when Dr. Killeen started this within other emergency department doctors, they realized that they were providing the most expensive care as the patients come in to do this. And what they wanted to do was create a picture in their minds of what the patient was going to look like before they actually came in. The more they know, the more intuitive they are about the patient, the more effective and timely the care will be. So as they started forming their picture and their storyboard in their head, they started with a wreck. You know, a patient they're in a wreck, they call the 911 dispatch.
This is at the police.
At the police. So now we're at the police department.
Yeah.
Then it goes to the first responders at the fire department. So there's little bits of information being collected. So as they're drawing the picture in the head over at the emergency department, the doctor, they're moving across the system. More data is being collected. They gather at the emergency department, and they're still filtering the information that comes in. So as they did this, they realized that there are a large number of stakeholders that all had a common thread. They needed to create a picture in their mind and be able to move forward and to have a common way of talking. So when they talked to the fire department, when they talked to the police department, they weren't using the same picture in their head to move forward.
Okay, so you've got a lot of people here.
A lot of people.
And they're all talking their own different languages, the language of the police, the language of the firefighters, the language of the ambulance drivers, the emergency room people, the doctors, the nurses. They're all talking differently. So Dan, how did you engage them? What happened? How did you get started?
Well, it's really a two-step process that we had for this. The first one was to get all of the stakeholders to agree to meet in the room together. So, once again, going through the process like we did before, you have someone calling 911, it goes to the dispatch system, and they have this drawing, and it's a pretty comprehensive drawing that takes you through the entire paradigm or the entire timeline from the ambulance coming in. They start doing assessments and triaging with the nurses. They gather information. They're pushing information out to other systems. But if you notice these lines, they're not connected. There's not a cohesive whole of this. So as they go through the process, they finally get down to the emergency department. As the emergency department moves forward, then it finally goes to the doctor. The doctor is still, though, dealing with paper reports and paper information that somehow get in, or they've got to recreate it and re-triage the patients.
Okay, so now let's make this real. I worked with some people in the Navy, and they said that the Navy is the largest employer in San Diego. And in addition, I understand San Diego's climate is very, very good. And there are a lot of vets that have moved to San Diego, and some of them are homeless. So how does this whole system help the situation for a homeless vet in San Diego?
Well, so as we look at this and this process, the idea is to get the right stakeholders at the table. And so as you mentioned, it wasn't just the hospitals and the first responders and the fire department. We still needed to include other people, such as the Veterans Administration and others. So here we have a full picture. And as we see the comprehensive picture, we're able to get all the stakeholders together at the table to move forward and to be able to build a common picture. So the first step is imagine hospitals, public health, EMS down here over there, and now you have medical clinics, the VA as you had talked about. And as we move forward with this, imagine all these people together at a whiteboard, drawing pictures. And as they're drawing pictures with their pens, they're discussing, what do you mean by this information? What do you mean by this piece of information? Fortunately, whiteboards allow for a lot of erasing. But over a period of time, what they were able to do was to build a common path and a common road that goes up through this process to be able to move forward together as a community where each individual, like Dr. Clean, was able to look at the information and say, wait, they all had their aha moment. And I think that was a big piece of the process with this, as they were able to move forward and to be able to bring people together at the table to have a common view to protect that patient. So as we go forward with the patient, now you're looking, as you mentioned, there's a lot of veterans there. A lot of the people that had the need that would go to the emergency departments all the times were veterans that needed help and information to do this. But the process really starts with the ambulance.
Okay, so let's take a look at this ambulance situation. Now, I understand that the homeless vets end up being brought for multiple trips. I think you said frequent flyers.
Yes,
frequent flyers on the ambulances. And what people are trying to do by coordinating and talking is to reduce the number of trips that the same homeless vet would take on an ambulance.
Right, so there's two aspects to this. One, obviously, is for the care of the patient. So they found that different hospitals were treating the same patient, and they were all going through the same picture process, collecting the information and gathering a picture. So as you see from this slide, what we're able to do is you have multiple ambulances going into different systems, but they have this new thing in the middle here called an EMS hub, Emergency Medical Systems Hub. They found a common point where they could start building a common picture for the information that comes out. So the fire department, the hospitals, the law enforcement, and the Veterans Administration, the clinics were able to build these systems and be able to have a more common picture.
That's still a lot of paper. That might be a common picture at that funny little EMS hub thing, but it's still a lot of paper. Let's take a look at what kind of paper.
Well, so let's look a little bit at the paper. So here's then the EMS hub, and there's a lot of information here. These are patients that are coming in. They're en route, in this case, to the University of California, San Diego, but they could actually tell you where their locations, where they're going to other hospitals.